Hello everyone. In this video we will learn about internal capsule. The objectives of the class will be to know about the internal capsule, its relation and its part, components of internal capsule, arterial supply and its applied anatomy. Internal capsule is nothing but it is a type of projection fiber. That means it is a white matter fiber which extends from the cerebral cortex to other part of central nervous system. So it is a compact V-shaped bundle with concavity directed laterally. You can see in the image, which is the arrow marked is the internal capsule. You can see a V-shaped compact bundle with its concavity directed laterally. So internal capsule is nothing but it is the white matter fiber which is the continuation of corona radiata. So the fan-shaped corona radiata continues as form a compact bundle that is called an internal capsule, and that continues to the midbrain as crus cerebri. So internal capsule is present between the thalamus and caudate nucleus medially and lendiform nucleus laterally. So here you can see in the image the red color marked one is the internal capsule, and we can see the caudate nucleus and thalamus medially and the lendiform nucleus laterally. The internal capsule is divided into 5 parts. They are an anterior limb that is present between the caudate nucleus and the anterior part of lendiform nucleus, posterior limb that is present between thalamus and posterior part of lendiform nucleus, and genu, that is anterior and posterior limbs of internal capsule meet at an angle which open outwards. The next part is the retrolendiform part that lies behind the posterior end of lendiform nucleus. Next is sublendiform part, that the fibers of the sublendiform part pass below the lendiform nucleus. That's why it is called sublendiform part and retrolendiform part. Now, what are the components of internal capsule? As I said, internal capsule is nothing but it is a white matter fibers. That means the axons of the neurons. So it will be ascending fibers and descending fibers. The ascending fibers are sensory fibers and descending fibers are motor fibers. The ascending fibers will be mostly coming from the thalamus. So the fibers from the thalamus reach the cerebral cortex through the internal capsule. Okay, so we can call that as anterior thalamic radiation that passes through the anterior limb of internal capsule, superior thalamic radiation that passes through the genu and posterior limb of internal capsule. And we can see the descending fibers that are some of the fibers that reach the pontine nuclei, and they are called frontopontine, paretopontine, temporopontine and occipitopontine. Some of the descending fibers that will be reaching the spinal cord, they are called corticospinal tract. The fibers of the corticospinal tract is mainly present in the posterior limb. They are arranged as upper limb, trunk and lower limb. Next is the corticonuclear fibers, that is from the cortex to the nucleus, cranial nerve nucleus. Okay, so that is present in the, to the face, that is present in the genu. So once again we can see the motor fiber that is passing through the anterior limb is the frontopontine, and the sensory fiber that is passing through the anterior limb is the anterior thalamic radiation. The fibers they are passing through the genu are frontopontine fibers, corticonuclear and corticospinal fibers for head and neck, and the superior thalamic radiation. Posterior limb The fibers passing through the posterior limb are frontopontine fibers, corticospinal fibers for upper limb, trunk and lower limb, corticorubral fibers, and the sensory fibers will be the superior thalamic radiation. Next is through the retrolendiform part, the fibers which passes through are paretopontine, occipitopontine, posterior thalamic radiation. And the sublendiform part, they are paretopontine, temporopontine and inferior thalamic radiation. Okay. So, through the internal capsule, there are ascending fibers and descending fibers travels, and the ascending fibers will be coming from the thalamus to the cerebral cortex, and they are the thalamic radiations, anterior, superior, posterior and inferior thalamic radiation. And the motor fibers or the descending fibers which are coming from the cortex to the pontine nuclei are called frontopontine, paretopontine and occipitopontine fibers, and from the cortex to the spinal cord are called corticospinal fibers, and to the cranial nuclei are called corticonuclear fibers. Now, the arterial supply of internal capsule. So, the internal capsule, anterior limb is supplied by the, you can see in the image, the anterior limb is supplied by the anterior cerebral artery. Okay, so they are the branches of anterior cerebral artery and branches of middle cerebral artery. You can see in the image, branches of anterior cerebral artery and branches of middle cerebral artery supplies the anterior limb. One of a branch of anterior cerebral artery is called recurrent artery of Hubner. Okay, that is the longest branch of anterior cerebral artery which supplies the anterior limb of internal capsule. Okay, next is genu. Genu is also supplied by the striate branches of anterior cerebral artery. Okay, you can see the image, anterior cerebral artery, middle cerebral artery, and it also receives direct branches from the internal carotid artery. And the posterior limb is supplied by striate branches of middle cerebral artery and anterior choroidal artery. Okay, and one of the branch of middle cerebral artery is called Charcot artery of cerebral hemorrhage. Okay, which is the artery is more prone to rupture and cause hemorrhage. So the we talked about the anterior limb, genu, and posterior limb. Now the sublendiform part, that is supplied by the striate branches of posterior cerebral artery and anterior choroidal artery, and the retrolendiform part is supplied by the striate branches of posterior cerebral artery. So, this is the arterial supply of internal capsule. So, in a nutshell, the internal capsule, the anterior limb is supplied by branches of anterior cerebral and middle cerebral, and the genu is supplied by branches of anterior cerebral, middle cerebral and internal carotid artery. Posterior limb is supplied by branches of anterior choroidal, middle cerebral artery. Sublendiform part is supplied by posterior cerebral and anterior choroidal artery. Retrolendiform is supplied by striate branches of posterior cerebral artery, that you can learn from the image. Next, what is the importance of learning this internal capsule? Internal capsule, as I said, they are the the ascending fibers and descending fibers. They are coming, the fibers coming from the corona radiata are form a compact bundle. So, any small damage to a part of internal capsule will cause a widespread clinical symptoms. Okay, so for example, the cerebrovascular accident, that is stroke, is most commonly caused by the Charcot's artery. Okay, so we have learned in the posterior limb, one of the largest branches of middle cerebral artery is the Charcot artery of cerebral hemorrhage. Okay, so this artery is more commonly ruptured in stroke involving the internal capsule. Okay, so if this artery damages, it will cause widespread damage to the upper limb, trunk and lower limb weaknesses. Next is if there is, we have learned another artery called recurrent artery of Hubner, which is a branch of anterior cerebral artery which supplies the anterior limb. Okay, so if there is any damage or if there is any occlusion to this artery, it will cause damage to the fibers that are passing through that. Okay, so that condition is called faciobrachial monoplegia. That means it will cause, occlusion of this artery will cause weakness in the face as well as upper limb paralysis. Okay, there is another syndrome called anterior choroidal artery syndrome. So as we know, the sublentiform part and posterior limb of internal capsule, okay, both are supplied by the anterior choroidal artery. So this causes thrombosis, contralateral hemiparesis, impaired loss of sensation and homonymous hemianopia. Okay, so these are the clinical aspects of learning the internal capsule. So the area of internal capsule is more prone for hemorrhage and occlusion, thrombosis. Hemorrhage is more common in the Charcot's artery of cerebral hemorrhage, which involves the posterior limb, and thrombosis is more common in the recurrent artery of Hubner, which is present in the affecting the anterior limb of internal capsule. So to summarize, internal capsule is a type of projection fiber. It is a V-shaped compact bundle of white matter fiber which continues from the corona radiata, and it has an anterior limb, genu, posterior limb, retrolentiform part and sublentiform part. It presents between the caudate nucleus and thalamus medially and lentiform nucleus laterally. The fibers passing through the internal capsule will be the ascending fibers, the thalamic radiation, and the descending fibers will be the corticopontine, corticonuclear and corticospinal fibers. And the arterial supply, the anterior limb, it is actually supplied by anterior cerebral and middle cerebral artery. Genu is by the anterior, middle and internal carotid artery. Posterior limb is by the posterior cerebral, internal carotid arteries, and retrolentiform part is also supplied by the posterior cerebral artery, and sublentiform part is supplied by the posterior cerebral and anterior choroidal artery. So this is all about internal capsule. Thanks for listening. Thank you.